Carers make a significant and highly valued contribution to supporting people in Renfrewshire. The Scottish Government recognise the role carers have in supporting people in the Carers Scotland Act 2016, which sets out a legislative basis for supporting carers. The Act commenced in April 2018 and Renfrewshire Health and Social Care Partnership is delivering on the Act locally on behalf of Renfrewshire Council and NHS Greater Glasgow and Clyde. The Carers Act set out a duty to prepare a carers strategy. The 2011 census found that 10% of the population of Renfrewshire are carers. 59% of Renfrewshire's carers are female. 54% of Renfrewshire's carers are employed, and 19% of Renfrewshire's carers are aged 65 and over. However, the Scottish Government's 2015 publication Scotland's Carers recognised that the number of carers is underreported due mainly to carers not recognising themselves as such. Scotland's Carers estimated that 17% of the population are carers. In 2017-18 we supported 665 new carers in Renfrewshire. However, this is only the carers who recognise themselves as such. Many more carers who do not see themselves as carers will also be receiving support from organisations. The 2017-18 Health and Care Experience Survey found that 64% of carers in Renfrewshire who responded reported that they have a good balance between caring and other things in their life. This compares to 63% for Renfrewshire in 2015-16 and 65% for Scotland in 2017-18. 35% of carers said caring had not had a negative impact on their health and well-being. This compares to 34% for Renfrewshire in 2015-16 and 39% for Scotland in 2017-18. 44% of carers said that they have a say in the services provided for the person they care for. This compares to 45% for Renfrewshire in 2015-16 and 46% for Scotland in 2017-18. 38% of carers said that local services are well coordinated for the people they look after. This compares to 38% for Renfrewshire in 2015-16 and 40% for Scotland in 2017-18. 35% of carers said they feel supported to continue to care. This compares to 39% for Renfrewshire in 2015-16 and 37% for Scotland in 2017-18. The Carers Act came into effect on the 1st of April 2018 and aims to support carers' health and well-being, helping them to remain in their caring roles and to be able to manage their own life alongside their caring responsibilities. The Act placed a number of duties on local authorities and health boards, and the key parts of the Act which the Health and Social Care Partnership has responsibility for implementing are the duty to develop and offer an adult care support plan to someone who is identified as a carer, a duty to set out and publish local eligibility criteria, a duty to provide support to carers who have eligible needs, a duty to publish a short break services statement, a duty to provide carers with information and advice services, a duty to involve carers in the planning of services, and a duty to develop a local carer strategy. Other parts of the Act, including the implementation of young carers statements and the involvement of carers in the hospital discharge process, are the responsibility of our partners in Renfrewshire Council's Children's Services and NHS Greater Glasgow and Clyde respectively. The HSCP will continue to work with our partners across the voluntary and statutory sectors to implement the Act. The Carers Act included a duty to set eligibility criteria to determine whether to provide support to carers to meet identified needs. In January 2018, and following consultation with carers and carer organisations, Renfrewshire Integrated Joint Board approved Renfrewshire's eligibility criteria for adult carers. All carers in Renfrewshire can access information and advice relevant to their caring role. What support carers may be eligible for in addition to information and advice will be determined by the completion of an adult carer support plan, which will identify a carer's needs and outcomes to enable them to continue to care. The HSCP has a duty to provide support to carers who have substantial or critical needs This support may take the form of a break from caring. For carers whose needs are moderate or low, they can access services such as training and one-to-one support. Renfrewshire Health and Social Care Partnership and its partners, including Renfrewshire Carers Centre, provide a range of support to Renfrewshire's carers. All carers can access information and advice relevant to their caring role. The services carers may be able to access in addition to this will be determined by completing an adult carer support plan. All carers are entitled to an adult carer support plan if they request one. The plan will set out a carer's own circumstances and the nature of the caring role. The plan will also help carers to think about what support they might need if they wish to continue caring and what could help them to have a life alongside caring. The plan sets out any needs carers have and how they will be met. In Renfrewshire, we have listened to carers who said that they were reluctant to approach statutory services to request an assessment of the support they require to enable them to continue to care. As set out in the Adult Carer Support Plan pathway, carers can now request a plan from the Carers Centre, and when a carer has moderate or low needs, they can complete their plan with the Carers Centre. Where a carer has critical or substantial needs, the Carers Centre will refer the carers onto the Health and Social Care Partnership, and a worker will complete the plan with them. It's important that carers find time for themselves. It can be challenging to look after someone if you don't take time out for yourself. The Integrated Joint Board approved Renfrewshire's Short Break Services Statement at its meeting on the 25th of January. The statement set out the policy on providing short breaks to carers, as well as information on how carers can access a short break. The statement adopted Shared Care Scotland's description of what constitutes a short break. A short break is any form of service or assistance which enables a carer to have periods away from their caring routines or responsibilities. The purpose is to support the caring relationship and promote the health and well-being of the carer, the supported person, and other family members affected by the caring situation. The Health and Social Care Partnership is working with Renfrewshire Carers Centre to develop a range of information resources on short breaks. A universal pathway is in place across all Greater Glasgow and Clyde hospitals to identify, involve and support people with a caring role. When someone is admitted as an inpatient and stays overnight or longer in hospital, they will be asked if they have someone who looks after them. If the patient is a carer and the person they care for requires help while they are in hospital, we will ensure that the person they care for is looked after. If the patient identifies a carer, they will be asked for permission to share information about their ongoing care and discharge with the carer. If permission is given, we will discuss and provide updates on ongoing care and involve the carer in discharge planning arrangements. If no permission is given, we will still ensure the carer is aware of support available to them through local carer support services. If multiple carers are identified, we will ask the patient to nominate one key contact through which to coordinate communication. The Carers Act set out a duty for NHS boards to involve carers in the hospital discharge process. The process is in place across NHS Greater Glasgow and Clyde is that healthcare professionals will discuss ongoing treatment and care arrangements with the carer, if consent has been given by the patient for this to happen. Healthcare professionals in the ward will listen to both the cared for and the carer's views on proposed discharge arrangements. Healthcare professionals may involve social care services in helping make decisions about the patient. Prompts are also included in the discharge checklist, which is completed close to the time of discharge, and training has been developed for frontline staff to guide them through this process. The Health and Social Care Partnership's key principles for supporting carers are that carers are key partners in the delivery of care. All carers who request an adult carer support plan receive one. All carers have access to information and advice relevant to their caring role. Carers receive the right level of support at the right time. Staff have the knowledge and skills to identify and signpost carers early in their caring journey, ensuring a focus on early intervention. Carers are involved in the assessment of the person they care for and the subsequent care planning. The key actions over the lifetime of the strategy are to deliver a comprehensive programme of carer awareness training to health, social care and wider partners. To develop guidance material to support this carer awareness training programme. To develop and deliver a communications and engagement programme to raise the profile and awareness of carers. To develop robust pathways for carers across all partnership services, sharing best practice in identifying and recognising carers. To review the paperwork and process for adult carer support plans. To review carer information resources for both carers and staff to ensure it is relevant and up to date. To review local eligibility criteria and revise the document where necessary, ensuring that carers, relevant staff and partners are consulted on any changes, and to develop a pathway and protocol for transition planning for young adult carers. The key outcomes for carers that the Health and Social Care Partnership will work to achieve are: carers are identified at the earliest opportunity and offered support to assist them in their caring role. Carers have the information, advice and guidance they need. Carers can take breaks so they have a life alongside caring. Carers have improved health and well-being. Carers are involved in health and social care decisions about themselves and the person they care for, and carers have access to the support they need to continue to care. We will know if we have been successful in achieving these outcomes if there is an increase in the number of people being identified as carers, if there is an increase in the number of carers who have completed an adult carer support plan, if more carers say they have a good balance between caring and other things in their life, if less carers say caring has had a negative impact on their health and well-being, if more carers say they have a say in the services provided for the person they care for, if more carers say that local services are well coordinated for the people they look after, and if more carers say they feel supported to continue to care. Work will continue to develop the strategy over the next few months. The draft carer strategy will be available on the Health and Social Care Partnerships website to allow people to have their say. We will hold a consultation session with carers and ask the integrated joint board to approve the strategy. And once the strategy is approved, work will begin on implementing it.